Hi class, it's Dr. Lindner. Just wanted to review Osgood-Schlatters disease with you. I know it sounds very serious because it's got the word disease attached to it, but let's just review the quadriceps, right? So the quad means four, vastus means immense, so there's four quads, three of the four have the word vastus in it. There's a vastus medialis, a vastus lateralis, there's rectus femoris, and deep to this is the vastus intermedius. Okay, this one, the sartorius, has to be moved a little bit. So if we take off sorry, it's a little bit tough here. I gotta move the TFL, and then we can remove the rectus femoris. And when we remove it, deep to it, right in here, that's the vastus intermedius, okay? So those muscles are the four quadricep muscles, okay? Now, let me see if I can get this back just right so we can understand what happens with Osgood. There we go. So now, superficially, we can see we've got the vastus medialis, vastus lateralis, and rectus femoris. The rectus femoris is the only one that crosses two joints. It crosses the hip and it crosses the knee. All of them cross over the patella and attach to the tibial tuberosity or tibial tubercle. Now, if there's an imbalance between the muscular strength between the medial and the lateral quadricep muscles, then you can understand that there could be an improper tracking or a pulling of the bone to the stronger muscular side. So if the medialis is stronger, the patella shifts medially. If the lateralis is stronger, the patella shifts laterally. So we want equal strength and balance of these muscles, okay? Now, if there's an imbalance in that and the patella shifts, they call that chondromalacia patella. Now, the strength of these muscles come across and attach to the tibial tuberosity. From such strong muscular contraction in sports like soccer with strong kicking and ice hockey and basketball, where you need these explosive, really hard explosive quadricep contraction, when the teenager is developing and the muscles are stronger than the bone starts to avulse, it starts to pull away. So you start to get this real knobby, prominent tibial tuberosity from strong muscular contractions. The quad tendon crosses over the patella and attaches to the tibial tuberosity as the infrapatellar tendon, and that pulls and pulls and pulls on the bone, creating like this avulsion of bone, almost like a spur that starts to attach there. And they call that Osgood-Schlatter. So there's pain that's in the knee, typically in the early teenage years from 13 till about 15 or 16. There's lots of conservative treatment and therapies that could be done to manage the pain and discomfort. So that is the Osgood-Schlatter. When you have an imbalance between the quads and it pulls the patella off track, then that's what they call chondromalacia patella, because the patella, which we can see here, when it's pulled off its track, either laterally or medially, you can get this wear and tear of the articulation, where the articular surface starts to degenerate. And that's where, when the knee starts to bend, flex, and extend, they feel a little clicking and little crepitus and little cracking. And it is a form of degeneration on the underneath surface of the patella and how it articulates in its track in the distal femur. So hopefully that gives you a better understanding between Osgood, Schlatters disease, and Chondromalacia patella.